Thank you, Micronesia. The next speaker is Malaysia, to be followed by Vanuatu. The floor is yours, Malaysia.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Chair, DG, Deputy DG, ladies and gentlemen. Malaysia wishes to thank DG Tedros for his keynote address and acknowledges his leadership in spearheading WHO in these turbulent times. We also take note of the comprehensive report of the Regional Director of the Western Pacific region. Malaysia applauds WHO for the information document on workplace culture and organizational change in the Wipro region. Malaysia recently established a healthcare work culture improvement task force to ensure a supportive and safe workplace in which we adopted pride, people first, respect, integrity, duty of care, and excellence as our core values. We are all policymakers in healthcare where our duty of care to patients is paramount. It is imperative this duty is extended to all our staff who provide that duty of care by ensuring they are valued and respected, and there is no place for any form of harassment. There must also be rigorous adherence to fairness and due process in any investigation. The pandemic exposed significant gaps in global preparedness for and responding to pandemics. This situation has led to impending negotiations for targeted amendments to the International Health Regulations 2005. Accordingly, Malaysia looks forward to contributing our input to the upcoming working group on amendments to the IHR, which will convene next month. The amendments must be focused on solidarity, transparency, and most crucially, equity. Let's not even pretend that the response to COVID was even remotely equitable, especially by developed countries who largely saved themselves first. We know that health is dependent on many factors outside the ambit of healthcare, and that is where we are reminded of the social determinants of health. We advocate for the shift from a disease-oriented model to a person-centered wellness approach that involves the entire government and society working together, and this is embedded in the Health White Paper for Malaysia Healthcare Reforms. Healthcare cannot succeed in a silo. We must create socioeconomic conditions that will enable people to be healthy, from poverty, education, housing, nutrition, planetary health, and much more. And this call goes hand in hand with our efforts to achieve the SDGs. Malaysia is shifting our focus to intensify NCD prevention. We are facing a double burden of health issues related to the usage of conventional and electronic cigarettes among our population. The government has put forward a new control of tobacco product and smoking bill called the Generational Endgame that will prohibit the sale and usage of all types of smoking products to our generation born from 2007 onwards. Despite the pushback from some lawmakers and the tobacco industry, we are determined that our vision for a tobacco-free generation will not waver. Malaysia is also committed to addressing society's mental health burden. Unfortunately, the lack of awareness and social stigma in mental health and mental illness has prevented affected individuals from coming forward for help, treatment, or intervention. Hence, we recently launched the National Center of Excellence for Mental Health, and this center will integrate public, private, and non-governmental actions to enable the sharing of resources of mental health experts to translate research findings for policy and program development. We must continue to shine a light on this silent epidemic. We are drawn towards transforming our people to become more inclined towards health-seeking behavior. Most people wait until they are very unwell before they actively seek care from the doctor. We need to evolve from sick care to health care and wellness to prevent chronic illnesses from unhealthy lifestyles. Therefore, we believe behavioral science has been an integral part of our region's success story in controlling the pandemic and minimizing the disease burden. Hence, Malaysia is proud to announce that we will propose a resolution on behavioral science for better health at the upcoming 152nd session of the WHO EB in January 2023 and the 76th World Health Assembly in 2023. We call on member states to support this resolution. Finally, Malaysia looks forward to a fruitful deliberation of these next few days as we come together as a region. Let us not squander the lessons from the pandemic, which has put health front and center on government's agendas and people's lives. The time for health for all is now. Thank you.